Hi, I'm Dr. Edward J. Gross at Primera Plastic Surgery and Day Spa in Orlando, Florida. Today I'm going to demonstrate Botox therapy with my patient Lindsay. Before we begin, I often ask the patients to animate so we can locate the muscles for treatment. Okay, so first we're going to clean the areas for treatment, which include the forehead, the eyebrow, and the corner of each eye. This provides us antisepsis. The next thing I'm going to have you do, Lindsay, is go ahead and raise your eyebrows up for me, and this demonstrates the frontalis horizontal lines. Relax that. So I'm going to go ahead and mark the areas for treatment with a little red X, and this is going to be where we actually put the Botox injections, which in Lindsay's case we want to reduce the amount of eyebrow lift that she has, as well as the ability to frown. Go ahead and frown for me. Hold that and relax. And now we can see also the muscle group called the corrugator, so we're going to mark that for treatment as well. So we have 2 injection sites here, 2 injection sites here, and 4 across the top. Go ahead and smile for me real big. Very good. Hold that. And then you can see over here at the corner of the eyes, there's a little crow's feet occurring. I'm going to mark that for 2 injection sites there. Keep smiling, and we'll do the same thing on this side. So these are our injection sites marked for Botox therapy, and this gives us a real detailed template so we can reproduce this for you when you return. Next, we're going to go ahead and give you the ice compress to cool the skin off and also to vasoconstrict. Here's your ice compress, and we'll have you start by putting the ice right in the center of the forehead. Very good. So she'll hold that there for about 10 to 15 seconds while I get the Botox prepared. It's already been drawn up, it's mixed with sterile saline, and now her skin is starting to become anesthetized and it's vasoconstricting the area. So we'll go ahead and do the injection in the little corrugator, which is right here. You can see that there's almost very little swelling when we do the injection. So at this point we've injected the corrugator muscles across her glabellar region, or the central forehead, which are responsible for this frowning movement. In about 5 to 7 days, when she tries to make that movement with her eyebrows, it really won't occur, and that will soften this area, remove these 2 little lines, and actually start to bring her brow up a little bit. So Lindsay is almost completely treated now. I have one final injection, which we'll put in the central corrugator region. And again, this treatment will not only soften the area for her, but it'll help to elevate the brow on each side and minimize the ability for her to frown. And now we're going to move over to the crow's feet area, which is at the corner of the eyes. So we've previously cleaned with alcohol, and now I'll have Lindsay apply the ice pack to the left side. And you'll see that I've pre-marked with the 2 red X's. This is a small muscle called the orbicularis, which is responsible for some of the squinting and the crow's feet that occur. Again, we're putting a small amount of the Botox in the area. And our final treatment site will be just at the tail of the brow. And so these areas have now been treated, and we'll wipe the area down, but you can see there's very little sign of treatment. Okay, Lindsay, you can open your eyes now. We've completed your Botox treatment at the corner of each eye. This is the crow's feet area. It looks great. We've also completed the treatment in your forehead, as well as the central forehead called the glabella. In about 3 to 5 days, you'll start to see the eyebrows come up a little bit, and it'll be a little bit more difficult for you to make that frowning movement, as well as we'll reduce some of the crow's feet and the little fine lines here. So you'll see some great results in about a week. How was it?
It was easy. Very good.
Minimal discomfort, right?
Minimal.
Okay, so now we'll let you go. You're off to work, and everything's nice and easy. Thanks for coming in today.
Thank you.
It's been 2 weeks since Lindsay's Botox treatment. We now have her before and after photographs. On the left, you can see some horizontal lines in her forehead and some crow's feet at the corner of her eyes. On the right, there's a dramatic improvement. Her forehead is smoother, the corner of her eyes are softer, she has a much more youthful appearance, and her eyes are more open and engaging. She's very happy with her Botox results. At Primera Plastic Surgery, we achieve consistently elevated BOTOX outcomes.